That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Well, hello, everybody. Welcome back. This is the Real Health Podcast with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and this is my other half.
Brandi, I am not a chiropractor.
That's right. And we intentionally
But I love chiropractors.
Put on the same clothes and have the same hair as the last episode. Actually, it's the same day. But we have a lot to talk about.
I was like, I can't believe you let our secret out.
We have a lot to talk about, and we have great articles. So, this is the podcast where we teach you and tell you how to feel better, get stronger, live longer, and feel younger.
Absolutely.
And so please pay attention and do what we tell you. Just kidding. Do what you want. We like freedom, right?
Freedom
Which
is so important.
This is the theme for this entire podcast today. This episode is the freedom episode. We want you to choose. We don't want anything to be forced on you against your will or your desire. We live in a free country. We've seen other countries. You and I have traveled to many countries.
Yes.
And we've seen there isn't a single place I'd rather live. I grew up in Iran. Our freedom was taken away and I moved. We still love the country. We go back when we can. You've been there 3 or 4 times.
Love the people.
People are great. Everything's great, but there's no freedom. We have freedom here.
Yeah.
And part of that freedom is freedom to choose, freedom to be able to speak your mind, freedom not to be judged as someone. Yeah, like you're a bad person if you disagree with me. You're not.
Yeah.
I respect you.
I'm fully okay if anyone out there does not, and we're just giving the content. We're not even giving heavy recommendations or anything like that. The one thing that is frustrating to me in our culture in the US is that people really struggle to have differing opinions. And I don't think we can ever move forward in science, in life, in anything if we don't get back to a point where we can have an open discussion about 2 different points of view. And we know in everything there's always multiple sides, but when we begin to try to silence one side so no one can speak, so that everyone else can be heard, that is such a red flag for me, because I think there's so much value in what everyone has to say. And it really helps me develop when I research that and I take into consideration what other people have shared with me. That's how I develop my decisions and my thought processes. And it's not just by listening to one side of the coin. It's always to listen to both. Yeah. And so I hope that you guys get how we're presenting and that's what we're doing here. And
you don't have to agree with everything we say.
Absolutely not. I hope that you don't. I hope that you take some of this and you go, oh, that's weird. I've heard something else, or I saw something different, and you go research it.
A while back I said testosterone goes up after having a baby, and one of you commented, the only brave person who commented, and said,
thank you for that.
Said, hey, you're wrong. It actually, look at the research, and turned out my information was outdated and old.
Yeah. So
and I apologized and I corrected it, and everybody knew, oh my gosh, he was wrong. He said the wrong thing. I'm good with that. Yeah. It's okay. And the one person who was confident enough to call me out on it, I respect you.
Yeah.
And please do it again if I ever am wrong about something.
Absolutely. That's what it's supposed to be like. So just FYI. So here's and I premise that because we're getting into a couple of really hot topics. And one of which is the recommendations for COVID shots, and boosters and vaccines and all of that. So make your own decisions, take what we present, take what you hear elsewhere, and then do your own research and come up with your own decisions. Don't do it because somebody said to. Do it because you've done the research and you know what is best for you and your family.
Or someone you love and respect did the research for you and you trust them.
Yes. So first one, CDC recommends updated COVID shot for everyone ages 6 months and up.
Not even 6 years, 6 months.
No, not 6 years. Everyone ages 6 months and older, according to Erica Edwards, who wrote this article, should get the updated COVID vaccines this fall. The Centers for Disease Control and Prevention said Tuesday. This move follows a vote from the CDC's advisory committee earlier in the day in favor of the recommendation. They're quoted in saying, "We have more tools than ever to prevent the worst outcomes from COVID-19, says the CDC director, Dr. Mandy Cohen. CDC is right now recommending updated COVID-19 vaccinations for everyone 6 months and older to better protect you and your loved ones. The shots are expected to be available within 48 hours. My first thing when I first started reading this was a couple of things. Number one, does everyone know that we've changed not that we, but the CDC actually changed the definition of what a vaccine was in September of 21? We're going to do an article about this a little bit later. So
September of 2021.
Yes.
Yeah.
So do some research on that. There's that information was changed, the definition of what a vaccine should do and what it should prevent or support.
So the definition was that a vaccine needs to create immunity to the pathogen,
which means you can't get
in
it
the human body. And the new definition says that it should create an immune response against the pathogen.
Right.
Not to create immunity, but just to create an immune response against the pathogen.
So it's supportive, it's supposed to help support the body in fighting it, but it is not supposed to remove the body's ability to contract it.
Right.
Right?
Yeah, and again, please don't think we're trying to be controversial here.
It's just important information.
There are a lot of smart people out there who make decisions like this, and I'm sure they had a big board meeting and discussed it and talked about it and had good reasons for doing it and all of that. We're just reporting on the facts.
Right. And it's important information because that definition may or may not change that decision in getting it, right?
Right.
In getting the booster or the vaccine. So that's why we point that out. My other question when beginning to read this is, which variant is the vaccine and the boosters for? Because just like the flu, it's constantly adapting and changing. So it's not a stable
Someone said there's the
virus.
39 variants. Someone said 47 variants. Someone said there's hundreds of variants of coronavirus.
Right. So that's now they in some of my research and what I saw is that they are tying most, if not all of the variants to the Omicron virus. Or that particular variant
which was the mildest one.
Right. So, and not in this one, but I do find it very interesting. In the next article, we'll talk a little bit about what people are seeing with COVID now.
Now, coronavirus was there prior to 2019.
Oh, yeah.
Because if you have old Lysol bottles, you can see one of the viruses that it kills is the coronavirus.
Yeah.
So, and I was pretty surprised because I'd never heard of it.
Yeah.
But it's literally written on the back of the bottle. Yeah. All disinfectants said they killed the coronavirus. So it wasn't a new thing.
So we're going back in. It says, it's unclear whether most people will get the new boosters or vaccines. However, just 17% of people who are eligible for the booster shot in 2022 got it. So it is a very low number of people getting the booster in comparison, I think, to what they'd like to see. The updated vaccines are rolling out mid-September or late summer. Uptick in COVID cases is what they're seeing. This week ending, which was September 2nd, 18,871 people were hospitalized with COVID, a number that reflected an 8.7 increase over the previous week. It says still the number of COVID hospitalizations is nowhere near what was seen in the same week in 2022 at 34,546. So although we are seeing a slow uptick now, it's still less than what we were seeing this time last year, not to mention the cases are not as severe. So that's a great thing.
That's a good thing. Absolutely. That was the goal. I think the goal originally was let's contain it and let's increase survival rate.
Correct. Although hospitalization rates are low, we have seen an increase in several weeks and anticipate further as we enter the respiratory virus season. So that's important. That's good stuff. The recommendation from the CDC's Advisory Committee on Immunization Practices was broad, suggesting that everyone 5 and older get a dose of a vaccine this fall. The group voted in favor of the recommendation 13-1. Now, I get really concerned when we start having, we start recommending things for babies, because I thought there was always a like kind of a kibosh put on testing on children and babies.
Right.
So my concern in some of these is, where is the efficacy? Where do we really know how this is going to respond or act in a child's body at very different developmental points in their growth and development? I mean, it's a big question. I think parents should ask
Yeah.
and should research before making a decision
Right. There are
on doing
genetic
something.
windows that the body goes through. And in each window, there's a developmental progress that takes place. And it has to happen in that window of time.
Mhm.
So, for example, the first 7 years, your lungs are completed. So within those first 7 years, injury to the lungs can cause permanent lung issues for the rest of your life.
Right. Yeah. It's a little scary. It says, in general, let me back up just a little bit. It says a comprehensive recommendation is the easiest, most straightforward, and simplest to communicate. Who is not a part of the, said Schaffner, who's not a part of the committee that approved this. I think that more people vaccinated are safer in our community, safer our communities will be, the fewer people we'll have in the hospital. I think my only thing that they're not taking into account is natural immunity that people have gotten from getting the virus, because we know that when you get the virus, that in a subsequent article, they actually speak to this, that your immunity is much longer with natural immunity. When you've gotten the virus and you've overcome it, your body can fight that much longer. I mean, we're
Right.
talking about
And
upwards of 12 months.
I want to make sure they know you're not saying this is your opinion. This
No.
is what we've heard some experts.
Yes,
You
this
know,
is what
I-
it's
I've-
stating.
I've always said, when there's an issue where the experts all agree, I follow along.
Yeah.
When there's an issue where half the experts say one thing and half the experts say another thing, that's when I go, we better do our own research.
Yeah,
And we
very
better make a
much.
decision. And there's going to be a risk. There's a risk to following one crowd versus following another crowd. Neither choice is risk-free. You're risking something if you go this side, and you're risking something if you go the other side.
Right. Yeah, it's very true. So they really speak to who the most weakened immune system, groups are. Those are the ones that they're saying, they're really targeting for this, is the most at risk, which they say are the elderly, immunocompromised, or children. It says, but the CDC's advisors included younger adults and children in their recommendations, citing evidence that 54% of kids and teenagers hospitalized for COVID had no underlying health problems, and would otherwise increase their vulnerability. But what I'd like to know, and my only issue when articles like this are putting out numbers, is it's only half of the picture. So tell me, of those 54% that were hospitalized with no comorbidities, what was the outcome? Because we don't have the outcome now. We don't know, was that full 54% good to go that didn't have those comorbidities? And this is why I like these kinds of articles, because I too want, and this is just how my brain works, but I want other people to ask those questions. Ask for the full picture before you make a decision, right? That's what we need to be doing. The advisors considered rare incidences of this. I found very fascinating. The advisors considered rare incidences of heart inflammation called myocarditis and pericarditis following COVID vaccinations. The risk was most notable, according to the committee, within a week of either of the mRNA vaccines among teenage boys. So they're saying within a week, there was a notable risk. The next paragraph then says, still, the committee said the benefits of vaccination outweigh the risk of myocarditis, even in these high risk groups.
So that's what I was talking about, is there's a risk to taking it, there's a risk to not taking it.
Correct.
Decide which risk you're willing to take. Decide for yourself.
Right. So do that research. There are always risks. It's about informed decision. The CDC committee's recommendations only apply to the updated COVID vaccines from Pfizer and Moderna. So the FDA is still reviewing data from other vaccine makers. So not all of them are created equally. So they're still looking, and we don't know why they're not created equally. We don't know what the background is, what the relationships are. There's a lot unknown in this area when it comes to vaccines and CDC and all of that. So
Yeah, a lot of work still needs to be done.
yeah. This is fascinating though, guys, where historically the government covered COVID vaccines and boosters. That's not happening anymore. So this, for the first time, the cost of COVID vaccines will not be covered by the federal government. Although most insurance plans, both private and public, will cover them, but the list price will top $100 per shot. So those who are underinsured, there will be like some community health centers to help bridge the gap for those that choose to get those boosters or vaccines. But just know that's not being covered anymore. So now we have a bigger decision to make, right? Because before it was just, it's available. Do I want to get it or do I not?
Yeah.
Now it's available, and it's now my responsibility.
Right.
Right. So now we're getting back into the your health is your responsibility era, which, guys, we need to be in anyway, because
Yeah.
I believe during COVID, we ended up kind of taking that from people. Even in emergent situations, we were so scared and so nervous in the medical world because we were dealing with a virus we didn't understand, and we didn't have a lot of information, and the information wasn't coming out fast enough. And there was so much of it, we couldn't parse through all of it, right? It was really hard. So we kind of took that responsibility away, saying, don't worry about it. We got you. This is the information you need to know. This is what you need to do. Don't think about it. Just do it, because it's an emergent situation and everyone is scared. And that's what we did. Now we're going, it's no longer emergent. The cases are no longer as bad. We are not seeing the same numbers that we did historically. We're seeing that healthy people are healthy. They're getting over it. This is all from these articles here. This is not my
Right.
This is
right.
not
we're
my.
We're just reporting what
I'm
the
just
article
reporting
says.
what the articles are reporting on. So they're saying COVID, although there's a spike right now, we expect to see that. We see that every year with other viruses. It's not as bad. People are not getting as sick, right? So they're really pushing these even more so for the immunocompromised, young, old, whatever the case may be. So I just think that's fascinating. And we also need to know, just like the flu vaccine, the vaccine for any virus, that the virus is constantly changing, it may or may not be current and as effective as you may like it to be. So now you got to pay for it. So this is why this information is so important. So do your research, figure out if that's best for you.
Yep.
Okay.
Next article.
Sorry, more COVID. In the ICU, doctors see a rise in COVID cases, but less severe. So this is really talking a little bit more about what I was just...
Because ICU stands for intensive care unit.
Correct.
So these are people who are, if you're not monitoring and watching them every minute of every hour they are there, they
Right.
could die. So their condition is pretty severe. And in the ICU, we're seeing more cases of COVID, and it's a pretty big deal.
Right. But they're still saying
It's
even
interesting.
those are less
Yeah.
severe than they
Right.
ever were before. So it says for more than 3 years, Dr. Christopher Ohl, hope I pronounced that right, has been treating COVID patients in the intensive care unit in Atrium Health Wake Forest Baptist in North Carolina. Lately, however, he's noticed a change. His patients are nowhere as sick as they used to be. What we're seeing now is our patients who are admitted with COVID pneumonia in the ICU tend to respond faster to treatment. They're less likely to die, and they're more likely to get discharged early, said Ohl. Also, a professor of infectious diseases at Wake Forest University School of Medicine, they don't seem to be as sick with it as they were 2 years ago. It's a trend in other ICU that other ICU doctors have noticed too. even as COVID hospitalizations continue to rise. Severe complications and extended hospital stays are less common now compared with several years ago. Dr. Cameron Wolfe, an infectious disease expert and associate professor of medicine in the Duke University School of Medicine. Generally speaking, they don't get that horrid hyperinflammatory disease that we were seeing a few years ago. We will see it to some extent, but not nearly as dramatic as it was. Just over 17,400 people in the U.S. were hospitalized with COVID the week ending in August 26th, according to the Center for Disease Control and Prevention, a 15.7 increase from the week prior. Hospitalizations are on the rise since early July after hitting an all-time low. So that's really good news. I
really
hope
good.
that cuts the fear for a lot of people.
I mean, it could be that this is the herd immunity they were talking about. As we're starting to, as a society, as a population, we're becoming more resistant
Absolutely.
and stronger in the face of something that's terrible.
Can we take a second and just talk a little bit about that? Because there are things that we hear all the time about things we should be doing to prevent the disease, like a vaccine or a booster. So, and for some of you, that might be the route you're going. So great. For others, they may choose a more natural route, right? Or they may choose to prevent naturally, meaning let me see what I can do for my body to boost my immune system and create the best possible outcomes for whatever virus or bacteria or illness that I encounter, right? What are some things that, from a medical standpoint, can people begin doing right now to improve their overall immune system function? What are some things?
Sunlight, exercise, nutrition.
Yep. Water,
meaning
good water.
Yep. Stay hydrated and keep a positive mental attitude. Fear kills your immune system.
Mm-hmm.
Fear, anything that puts your body in fight or flight, reduces the immune system. You cannot fight infections and disease when you're stressed, when you're worried, when you're nervous, when you're scared. You cannot. So I would say, just to add to what you said, because I agree with everything you said. Even if you go ahead and get the vaccine, which we think you should choose, and those of you who get it, good for you. And those of you who decide not to, hopefully you did your research, and good for you also. You made a wise choice either way, because you're doing what you believe is best for you, and no one else, including us, told you what to do. Now, but both sides should boost your immune systems. Both of you should exercise regularly, eat proper food, green vegetables, all colors, all the vegetables. Make sure your vitamin D is normal, and sunlight.
Yeah.
Hydration.
Yeah. They're really simple things.
Yeah.
If we just take time out of our regular day, being so hyper focused on work and on, all the things we have to get done, and just take 5 minutes out of the day and go, what do I need to do today for myself, right? Put on that oxygen mask that we're told to do before we do somebody else's. And what do I need to do to make myself healthier? I think that's a question we should be waking up and asking ourselves, because our body is such a fine-tuned machine. And most of the time we treat it like crap.
It's
so
true.
If we just spend a little bit more time taking care of ourselves, we owe it to ourselves, we owe it to our family.
And I forgot the most important part is sleep.
Sleep is important.
Sleep has the biggest effect on your immune system. Proper deep sleep.
Yeah. We should talk about some of that on an upcoming podcast. Let's see. Let me just do a couple more things I want to point out in this particular article. It's almost done. It says the vast majority of Americans, 95% according to the CDC, has some level of protective immunity to the virus, whether through vaccination, infection, or both. So
that's interesting. The CDC says 95% of you guys have high immunity against this.
95%. That's a really high number, and that is from the CDC
it's
directly.
Encouraging. Yeah, I like it.
Very encouraging. And they're also saying we don't know where all that's coming from. It could be from vaccine. It could be from
previous infection, or both,
or a combo. So regardless, 95%, fantastic. When you start to get sick with COVID, our immune systems are engaged rather than becoming part of the problem. They're more a part of the solution, Ole said. So people, those who are hospitalized now with COVID tend to have weakened immune systems, such as older adults, certain cancer patients, and people who have organ transplants. So it really seems like if we can keep our immune system health up, the majority of us have some type of protection against it. Like, take care of your body. Take care of that machine. I think we're good. Got anything else on that?
No, sleep well, exercise, mindset, I think,
Yep.
is huge. Be happy.
Happiness is important.
Laugh a lot.
Now, we don't have to spend too much time on this. This is the third one regarding vaccines and the COVID shots. This article headline, DeSantis administration advises against COVID shots for Florida residents under 65. So the subheader here, the statement contradicts the CDC's recommendation that everyone 6 months and up gets a new booster. I thought that was really funny to see.
Yeah.
Like they had to premise it, but we do too. Like, isn't it funny in this day and age, whenever we're putting anything out, we have to go, oh, by the way, that's not me.
Right.
Right. Because, we deal so heavily with the potential of censorship.
Yeah.
And this is my issue. We need to be able to give opinions, share thoughts and ideas, have respectful conversations without the fear of getting stuff pulled because it doesn't agree with mainstream stuff. Like, how do we push forward? How do we know unless we have these conversations?
Right. You think about it. First off, CDC doesn't want, I don't believe, CDC doesn't want people to be sick.
No.
Governor DeSantis doesn't want his state of Florida
Correct.
to be full of sick people.
Right.
So you can't question that. I mean, why would I know they nicknamed DeSantis Death Santis during COVID because he told people to stop wearing masks, and some people in Florida didn't like it. But then it was incredible how many voted for his reelection after all of that. So and if someone's a public figure and now he's running for president, he wouldn't want to do something that results in terrible tragedy and mass destruction and death and illness and all of that. So you go, where's he getting his information and why?
Right. So so it says, in a deviation from federal recommendations, DeSantis administration is advising residents 65 and under not to get boosters. What I have directed our department to do is to provide guidance that really recommends and advises against the use of mRNA COVID-19 vaccines for anyone under 65. The state surgeon general, Dr. Joseph Ladapo, said on an online panel hosted by DeSantis on Wednesday. The statement ignores the Centers for Disease Control and Prevention's recommendations. The agency said Tuesday that everyone ages 6 and up who's gotten a COVID shot within the last 2 months should get a new booster, which targets a subvariant of the Omicron called XBB.1.5. Interesting. Vaccination remains the best protection against COVID-19 related hospitalizations and death, according to the CDC. But Ladapo questioned, I hope I'm pronouncing his name right, questioned the CDC's rationale. He says, with virtually every walking human being having some degree of immunity and the questions we have about safety and effectiveness, especially about safety, my judgment is that it's not a good decision for young people and for people who are not at high risk at this point in the pandemic, Ladapo said. So he's, his thought, and he's an educated individual. He's the Surgeon General for the state of Florida. So I guarantee you, everyone before he made these statements.
Is that an elected position or is that an appointed position? Do you know?
I don't know. We would have to look that up.
Well, because the Governor DeSantis could have said, "Hey, what are your beliefs?" And okay, you can be Surgeon General. Either way.
I mean, I don't think it's out of the norm to choose a
it
Surgeon
doesn't take
General
away
who's
from
going
the
to
fact.
support your platform,
Absolutely.
right?
And it doesn't take away from the fact that he is a highly qualified doctor in
Trained.
a position of authority that we should listen to the opinion of, not follow blindly, but listen and research and study.
And compare. You know, those are the things that we want to do. Let's see if there's anything else great in that. They did say that DeSantis originally supported the COVID shots, noting in July 2021 that these vaccines are saving lives. Since then, however, he has built his administration healthcare platform around the notion that COVID vaccines are unsafe and unproven. So I wonder, he is appointed, by the way, a stance not supported by scientific consensus. Ladapo, whom DeSantis appointed in September of 21, has become one of the country's most prominent COVID vaccine skeptics. So there you go. So I don't know what else. I don't want to beat a dead horse. I love horses, by the way, but he's against it. You know, he has a very different stance, and it's a stance. I will tell people, I think if you're going to take a stance that is so controversial to 90% of what is being said by politicians or prominent figures or physicians or whatever, you probably have a really big reason. Yeah. The risk of being being made to look like you're an idiot or not educated or disagreeing.
You're risking your reputation,
you risk a
your
huge
livelihood, your future.
Right.
I mean, these are political figures who can literally sabotage, assassinate their future, their careers.
And we want to ask why. Why would somebody do that? So that's a question you should ask when somebody comes with such a varying or different perspective and is willing to announce it at great risk. So then you have to say why. So there's not too much more in that. I would say the only other thing is that he's not very far off from what the United Kingdom is doing also when it comes to their new and different vaccination strategy from what the U.S. is doing. It is offering boosters this fall, but only to certain groups, including ages 65 and up. Residents in elderly care homes and younger people elevated risks of severe disease. So DeSantis is not alone in this thought process. Ladapo is not alone in this. We have other countries that are following a very similar thought process. So I know in the U.S. we want to make him out to be the lone wolf, but he's doing something very similar to other countries that we sometimes look at and go, what are they doing?
I think people are speaking with their pockets. People are speaking with their feet.
Yeah.
So you look at how many people left certain states in the country and moved to other states. It all came down to that one word.
Freedom.
Mm-hmm. They wanted the freedom to choose. I believe you should all have the freedom to choose. We give you information. They give you information. CDC gives you information. FDA gives you information. You choose. Right. You want to eat sugar? Go ahead. I'm not going to judge you.
Right. I mean, here's the thing. We were all given the skills of reasoning and thought and use that.
I mean, next thing you know, the FDA and the CDC are going to mandate no sugar for anyone under the age of 14. I don't know. I'm just randomly.
That's going to create a civil war in this country.
No, you're not allowed candy. You need to show ID. You have to be older than 14 to buy candy. You know, just where's it going to stop?
Right. It sounds ludicrous. We laugh at it, right?
Yeah.
But that is the thought process that some people have.
And it doesn't bother me. Let's say one of these politicians. I know Arnold Schwarzenegger was very passionate about this. He got on TV. He said, "Screw your freedom." That was his words. Mm-hmm. He says, "Screw your freedom. Go get this." It's like saying, "I'm not going to follow the traffic laws. I'm going to drive on the other side of the road because I want to, and I'm going to hurt everybody else." It doesn't bother me that he's passionate about it. He believes in something. He's speaking up.
Yeah.
And plenty of people speak up on the other side of it. And the benefit to being here is we have the freedom to listen to both sides
and make a decision
and make our own decision.
Thank God for that.
Amen.
Scientists discover how brain cells die in Alzheimer's. I
that's a
was so
shift.
hoping to get through those three so we could talk about this.
Uh-oh.
Is
We
that
are
awesome?
almost out of time.
I know. So, do you want to save this one?
Why not?
Okay.
Why not?
So next time we are going to talk about scientists discovering how brain cells die in Alzheimer's. So this is a really big thing because there's so much unknown again about
and I also
that
want to
disease
talk
process.
about heavy metals that are found in cosmetics.
Yeah.
I found a research article. It's not a brand new thing, but I think it's something you all should know about because a lot of you use cosmetics. So we'll talk about those on the next podcast.
I love it.
Great job today.
Thanks.
Yep.
You too.
And thanks everybody for listening and being open-minded and respecting the freedom of all of us. God bless you.